So let's assume this is fixed.
Yes.
What's he gonna do? Let's assume it's a relatively clean break. It heals up, minimally invasive intramedullary surgery. What is his expected? Let's not specifically say this is in Matir's case, but in general, when you have this, what's the splinting? What's the rehab? How quickly will he progress? And then the later question is, what is the likelihood of when he'll be back?
Right. So here's the thing. Anytime we fix a fracture, we have to protect it for a period of time while it heals, right? So, first couple of weeks, you're in a thumb spica splint, and this is a splint that will incorporate the thumb so that there is no movement occurring at the thumb, give it a chance to heal. I usually convert patients to thumb spica casts after a couple of weeks of splinting. And then, at about 4 weeks, we convert to a thumb spica brace. So at that point, we can start then we can start rehab. And this is
So is it 6 weeks of immobilization?
So here's the thing. It depends on the fracture pattern. There are certain fracture patterns where I will start early in like gentle range of motion exercises. Say I would even start it at 4 weeks if it's stable enough and I know I have good fixation, and if I trust the patient as well as the therapist to proceed with caution, but just get some gentle range of motion started. So it's all very individual. But if it's a little bit more serious fracture pattern, or there's more instability risk, or the fixation may be a bit more precarious, then I'll sort of say, hey, let's just do it at 6 weeks, okay? But a lot of times I do like to start some early mobilization so that we don't have stiffness as a problem.
Right.
This is a PSA to everybody, so this isn't just athletes, this is to everybody, and I say this to every single patient that I have, is that surgery is part of the process. Rehab is probably one of the most important parts of recovery. And so surgery could be done perfectly end to end, but if you don't do that rehab, then getting back that motion, getting back to your usual activity, that can be impaired.